Dr. Zara, you can start now.
أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم. Dear viewers, Salamun alaikum wa rahmatullahi wa barakatuh. Welcome to this live talk show on pandemic preparedness, which is being aired live from Dar es Salaam, Tanzania. Before we begin, on behalf of the Central Health Board of Africa Federation and the Mahdi Health Initiative, we would like to convey our heartfelt condolences to the citizens of Tanzania on the loss of their president, His Excellency, the late Dr. John Pombe Joseph Magufuli. May I request that we observe a moment of silence in solidarity with the entire East African nation, and let us also remember our brethren who have departed for the next world during this pandemic with the Surah Al-Fatiha. Thank you. My name is Dr. Zahra Nagri. I'm a medical doctor by profession and a member of the Central Health Board of Africa Federation, as well as the Mahdi Health Initiative, which is a group of health professionals based in Dar es Salaam, and I will be your host for tonight. Tonight's webinar is aimed at addressing the various concerns and queries that we have received from multiple platforms with regards to the COVID-19 pandemic. I would firstly like to introduce our panelists who will be discussing different aspects of the pandemic, including transmission, signs and symptoms, precautions, and vaccination. Firstly, we have Dr. Shamsher Ali Ibrahim, who is a physician of internal medicine from Kenya. He has been actively involved in the diagnosis and management of both community and hospital-based patients who have been infected with the coronavirus. Secondly, we have Dr. Aliaskar Mukhtar, a medical doctor from Arusha who is in his final year of residency in emergency medicine and currently working at Muhimbili National Hospital of Dar es Salaam. He was also part of the emergency response team for COVID-19 both in Dar es Salaam and Arusha and played an active role in the management of coronavirus patients who needed emergency care. Finally, we have Sister Tabassum Manji, who is a nurse by profession. She completed her training in India and further specialized in trauma and critical care at Muhimbili National Hospital. She has years of working experience at different hospitals and is currently the head of the emergency department, the high dependency unit, and the intensive care unit at Sri Hindu Mandal Hospital in Dar es Salaam. Once again, I would like to welcome all our viewers and our panelists tonight. Without further ado, let us begin our discussion by talking a little bit about transmission of the virus. As of recently, due to the mutation of the virus, the list of signs and symptoms with which patients present is also expanding. Dr. Shamsher Ali, can you briefly describe the transmission process and highlight the new symptoms of COVID-19?
Okay. Assalamu alaikum and good evening, everyone. Yeah, so thank you for the opportunity. This is a virus, it's a viral infection. So the most common mode of transmission is through close contact. Close contact with persons who are infected, whether they have symptoms of the active disease or no symptoms of the active disease. The distance that has been found in studies is 6 feet. If you fall within 6 feet of persons with the disease or direct contact with a person such as a family member, you are at the greatest risk. And infection usually occurs when there's a transfer of the respiratory droplets that are released into the air from the infected person. So these ones can occur when the person is coughing, sneezing, even speaking. And in the community setting, we've got people who are reciters, public speakers, orators, they are even singers. So all of those, they release respiratory droplets. And those, when they're deposited onto the mucous membranes of other individuals, are exposing them. That is the most common way. The other common way, which is not as common as direct contact, is an airborne transmission, whereby the respiratory droplets linger in the air environment even after the infected person has left. Although it's not as common, but it is still one of the ways that you can contract the disease. We also have two other ways, one of which is contaminated surfaces, whereby you get the respiratory droplets have landed on a contaminated surface, contaminating it, and then you have handled that surface, and without certain preventive measures, you transfer them to your own mucous membranes, either the mouth, the nose, or the eyes. That means that you are handling your face without hand sanitation. Few isolated cases of animal to human transfer through pets has been recorded, but it's not very common. Although if you do have pets, then there are going to be some precautions you'll have to take in terms of limiting their movement and exposure to the outdoors. So that one is basically about the transmission. When we come to the signs and symptoms, the commonest signs and symptoms early on in the pandemic were a cough, a cold, a sore throat with fevers. But as the viruses have mutated and progressed to new variants, we are now getting new signs and symptoms. These include fevers, as previously noted, cough, chills, body aches and pains, muscle aches, headaches, new onset of loss of taste and smell, a sore throat, skin rash has been noted, some discoloration of the fingers and toes, nausea, vomiting, diarrhea has also been recorded, as well as conjunctivitis, which is inflammation of the conjunctiva, the membranes in the eyelids. So basically, any of those symptoms should warrant at least a checkup or a screening for you. Yeah. So that covers the signs and symptoms, including the new ones.
Right.
Back to you,
Thank
Dr.
you.
Zara.
So after having looked at the transmission, Dr. Aliaskar, can you remind us of some of the individual preventive measures that can be put in place to curb the spread of the virus?
Thank you very much for having us. Assalamu alaikum wa rahmatullahi wa barakatuh. So, as we just heard, the major mode of transmission is through respiratory droplets, when someone coughs, sneezes, or even speaks or breathes heavily. So this principle is important so that the preventive measures make sense. The preventive methods I'm going to mention are basically the same things that we have been hearing all along, but reminders are always good. So first, basic hygiene whilst coughing and sneezing, covering your mouth with a tissue or a handkerchief and disposing it off thereafter. Or in worst case scenario, you can cough into your inside of the elbow. Avoiding touching your eyes, mouth and nose, before washing your hands properly. This will also help prevent the disease. Washing your hands with soap and water for 20 seconds, as we've all heard about it. 20 seconds is about the time you take to recite Dua Hujjah, so that could be a good addition to your regimen. So before you touch your face, before eating food, after eating food, when you reach home, the first thing you should do, wash your hands, make sure your hands are clean. Wearing of a face mask is another important preventive method, especially when you are in public places. So face masks, we have seen how people have been wearing them. Some are wearing them correctly, others are not wearing them correctly. Touching the face mask at the front is not a good thing because that area is contaminated or potentially contaminated. If you need to remove your mask for any reason, we prefer that you remove it fully and put it in a Ziploc bag or put it in an envelope or something. Don't keep it in your pocket or put it under your chin because that's going to increase contamination again. Once you reach home, remove your mask. If it's a cloth one, wash it immediately and hang it out to dry. Or you can dispose it if it's a disposable one. Another important preventive method, as we have seen, that social distancing, the minimum length or the minimum is 6 feet. That's around 2 arm length. So with people who aren't in your household, so when you go out in public, make sure that you're maintaining that distance. So when you go out, think about it in this way: that potentially I am a carrier of this disease. Okay, and if I am a carrier, I might give it to someone. If I break that social distancing, I'll spread it to another person, which is not fair. The other way of looking at it is think about everyone else around you as potential carriers as well. As we know that 20% to 25% of the patients are asymptomatic. They don't present with any sort of symptoms. So think of it this way, and that's how we can maintain the social distancing. So as we have seen, crowds are bad, but crowds in a poorly ventilated area is even worse. So if you're in a crowd and then you are in an enclosed space, the risk of transmission is very much higher than compared to when you're outdoors. So this brings us to the next point, which is avoid poorly ventilated areas. So enclosed spaces which don't have good air exchange, which are packed on all sides, they just have ACs, not no windows open. That really causes, as Dr. Shamsher said, that this virus also lingers in the air for a few hours. That is evidenced in some studies. So you can think about this analogy like a person smoking cigarette. If he's in a corner of the room and the windows are all closed, even if it's in that corner, after he smokes, after some time, that smoke will disseminate everywhere. So similarly, this is what can happen. So a very important thing is to put your home in proper ventilation, open the windows. If you can install some air filters, that's even better. Another important preventive method is cleaning and disinfecting surfaces, which we have already talked about. Another thing is watch out for early signs and symptoms. Okay, we have seen the new list of symptoms. We know the old ones. Watch out for those signs and symptoms. And once you are sick, isolate yourself so that you should contain that disease. Don't give it to anyone else. Lastly, live a healthy lifestyle. Exercise, sleep well, hydrate, don't smoke or use alcohol. So these are important steps that we can take in order to prevent this transmission of this disease. Back to you, Dr. Zahan.
Thank you, Dr. Yaskar. I think that was a really good reminder of what we can do to stop the spread of the virus. And especially what you mentioned about the proper usage of a mask. I think that was also very important because sometimes we may be using the masks incorrectly or reusing masks that are no longer effective. So let us look at some of the practical scenarios in which these measures can be applied, because we've talked about staying at home as much as possible in order to isolate yourself and reduce the risk of exposure. However, here in East Africa, we sometimes have domestic workers and helpers that come to and fro our homes. So, Sister Tabassum, what can we do to ensure the safety and the health of our employees, both at home and in the workplace?
Assalamu alaikum, everyone. Thank you for having us. There are a few points whereby we can take care on how to educate them firstly. So if you know that one of your workers is sick, then allow them to rest at home. Like, don't force them to come. Educate them on how the transmission occurs, just like Dr. Shamsher Ali pointed out on the new signs and symptoms, which are alarming symptoms, whereby they have to go to the hospital and show it to the doctor, because for them, to actually go to the doctor is a lot of effort to take, because they first of all live far, there are transport issues and all that. So we need to teach them what are the symptoms which are important and which are the alarming symptoms. Like, even if your body is generally tired, even by doing the small chores, that means it's an alarming sign. You need to go to the doctor and show them probably there is something wrong. And another thing is by using the disinfectants. That is very important. Make sure you're teaching them the way of diluting it and how to use it, because most of the people, they go wrong in that way. They don't know how to use the disinfectants. Sometimes they use a lot, sometimes they use less. So it's best to educate them on how to use it. And for instance, if they're helping, for example, they're mopping at home. So make sure you're educating them that they should not use the same water when they have mopped the living room, for example, and then they should use the same water to mop the rooms, for example, whereby we sleep on, like in the bedrooms. So make sure that you're changing that water, disinfect again, use the disinfection, make sure you're using a fresh water. All those things, they need to be educated, because I'm sure nobody over there like is there to educate them regarding these small things. Another thing I would like to highlight is that whenever like they come to when they come to work at home, they usually use public transport, because they don't have they live far, so they use public transport. So when they come home, make sure that they're wearing masks. You educate them that why it's important to wear the mask, why when they come home, first thing they do is wash their hands, and after washing their hands, they straight away go to the bathroom and they shower, of course. And the clothes which they were wearing, of course, they were in an exposure, because of obviously in the public transport there are a lot of people whereby they sit nearby, so the exposure is higher, definitely. So when they come home, make sure that they are washing their clothes in maybe a diluted Dettol or anything like that, and then allow them to like dry in the sunlight or something like that, so it would be best for them. So these are the measures we can take to help them and also educate them, because if at all they practice this with us when we are educating them, so we are sure when they go back home, they can teach their family, their children, their elderly, whomever they're living with, their relatives, whoever is there with them. So at least they can educate them. No, this is what we are doing. So this is how we should continue doing at home to prevent the transmission. The other thing I would like to highlight is that also the diet. That is where they actually go wrong. Sometimes they only have one meal a day, or maybe just 2 meals a day. And even their children and their elderly, it's because of the financial crisis and all. So make sure that you educate them that even the importance of having even an orange a day, because it's rich in vitamin C. So at least that should be included in their diet. It's just not like one continuous diet. Like teach them different kinds of balanced diet, what they can do, what are the other alternatives they can use, and which are cheaper, readily available for them, so that they can take care of their immunity. Because that is where I think many people don't talk about. It's about the nutrition. Mostly we only talk about the hand washing, the wearing of masks, and social distancing. We don't actually concentrate on how they live and how we can help them to cope up with that situation, especially in the nutrition area. So that is one place whereby I feel that they are not educated properly. So we should make sure that we are educating them that oranges, avocados, which are readily available, they can use that in their diet, which increases immunity. Because definitely like fried stuff like fries and all that, which is readily available, is not very good. Make sure you teach them about unsaturated fat like avocado or fish, or maybe like natural sources like nuts. They should take more of that in their diet, because it's natural oil and not the fried stuff, because we are very used to having staple food like fries, and it's readily available, and of course it's cheap. So we need to tell them that not to consume that in higher amounts, of course. Another thing would be that once when you have already educated them, take time, sit with them and talk to them. Make sure that whatever you teach them or whatever they have been taught, they should tell you as well, that you understand that, oh, okay, whatever health education you have given them, have they really understood? What are they taking back home? Obviously, they are staying with us for a longer period of time at home. So when they're going back at their house, what are they going with? Is it like zero knowledge or something? At least something they should understand. So it's our responsibility to make sure that at least when they're going home, they're going with something and not just empty-handed, So this is our responsibility. We need to make sure that we need to teach them about the essentials of hand washing, how their children can maintain social distancing by playing with their friends, but with a social distance, not shaking hands. Make sure that they're washing hands every half an hour. And whenever they're going, they should avoid gatherings. Even if they're talking with their friends, it should be a bit far, not very near. And why they need to do that? Because it's for their immunity and for their health. So over to you, Dr. Zara.
Thank you, Sister Tabassum. I think you pretty much covered all aspects of how we can look after our domestic helpers and workers and our employees, because At the end of the day, they're working in close proximity to us, and therefore we must ensure their health and safety as well. Now, although most countries have lifted their lockdowns, but that doesn't mean the pandemic is over. Life has to go on and people have to carry on with their day-to-day activities. So, Dr. Shamsher, what advice would you give people who may be necessitated to go to crowded places like shops or marketplaces? We talked about public transport briefly, and even mosques and other places of worship, especially with the holy month of Ramadan less than a month away.
Yes, a very important question. But before I answer it, I would like to just give one statistic to show the magnitude of the situation. As of 20th March today, there have been over 121 million confirmed cases globally. That's a large number. And if we are talking about deaths, we are again talking of millions of deaths, almost 3 million deaths. So the virus is still spreading, the infections are still present, infecting people. So as was mentioned by Dr. Liasgar, your preventive measures has to be in place. There's no if about that. There's no maybe. It has to be in place. You have to protect yourself and others. And there is one general rule that generally everyone should follow. The more closely you interact with others and the longer you interact with them, the higher the risk of spreading or getting the infection. So try to limit the duration that you're interacting with others and try to limit the number of persons you're interacting with. That said, there will be some particular items which will now be necessary carry on for individuals. Masks are going to be something that is going to be an everyday thing. For instance, where in Kenya, masks is a legal requirement now for anyone who steps out of their home. Hand sanitizers are also highly recommended. Some persons would carry tissues because those are easily disposable compared to handkerchiefs. We're not going to start discarding all our handkerchiefs once we use them. So tissues are easier to discard, but discarding them in a safe way. And avoiding crowds and poorly ventilated areas and washing hands frequently. But there will be some particular areas that will need some special mention, like restaurants, eating out. If necessary, try to get takeout or deliveries done rather than going to the restaurant. If you must go, try to make sure or ensure that it's preferably an open air restaurant, or try to have a minimum 6 feet distance between tables so that you do not have to interact with persons you are not normally interacting with, like family members. If you're going to be given an option, try sitting outdoor rather than indoor, since indoor the ventilation is not going to be as good as outdoor. If you are going to be running errands, first and foremost, don't if you're not well. Stay home and evaluate your symptoms and try to seek medical advice. You can try online shopping, which is also available in most countries. But if you do have to go out, again, the same thing: masks, sanitizers, social distancing, and hand washing. In fact, those will be routine for every place that you attend, be it the mosque, the temple, the church, the school, the hospital, wherever you go. Masks, social distancing, hand sanitizers, and hand washing is going to be something that we have to incorporate in your day-to-day. Try to avoid touching surfaces that are frequently handled, door handles, surfaces like counters in a shop or at the supermarkets. Try to limit, if you are a driver of a public transport vehicle, try to limit the number of passengers you are carrying. If you are employed and you're going back to work, again, frequently touched surfaces, door handles, desks, chair handles, the washroom doors. Make sure that you have proper hand washing facilities and sanitizers. You can even inquire with your employer if they've got precautions in place to prevent the spread of infections at the work environment. Religious activities are an area that have to be mentioned, and there are certain practices that are not necessarily a must to be done, right? So nobody is going to tell us that don't go to your place of worship, but try and follow all your preventive and precautionary measures. The social distancing applies everywhere with persons you do not live with. The hand washing, the masks, the sanitization, everything has to be in place. So basically, wherever you are going, you have to follow the preventive measures as outlined earlier and try to limit the time you are spending outside. And if you cannot, then try to limit the number of persons you're interacting with. Back to you, Dr. Zara.
Thank you, Dr. Shamshar. You mentioned about going to school, and Sister Tabassum, we've received a lot of concerns from parents, particularly who are sending their children to school. So, and whilst you're addressing that, can you also talk a little bit about the precautions that must be taken by pregnant women and mothers who are breastfeeding?
Regarding the children, the rule stands by the same that under age of 8, it's best for them not to wear the masks, but the hand washing, the social distancing, still they can do. Make sure that you're educating them to the utmost, like explain them with the practical examples, like what can they do, like for example, like in the toddlers, for example, in the preschool, when they go, they have something like circle time. So educate your child that why it's important to sit a bit away from their friends, and why are they doing that, why they shouldn't shake hands with their friends, and whenever they're greeting them, it's best to do it from a distance and not play very closely or in a very large group. And I believe that nowadays the schools have already started using this kind of precautionary measures already, which are already in place, and they are doing it. So whenever a child is entering the school, first thing they do is either they sanitize their hands or they're washing their hands. They are making sure that the shoes where they go in with is changed. So one of the sleeper pair is kept inside, like in the school premises, whereby when they enter, they remove those shoes which they're wearing, where they go with to school. They wear the ones which are in the school premises, and then they enter their classrooms, and then they are given like proper social distancing and how to take care with the hand washing every half an hour and all that. So that I believe that many schools are already practicing. For pregnant women, I believe that firstly, it's very important with the nutrition, that they need to take care about what they're eating, what are their calorie requirements. They need to meet that, because usually that is usually forgotten. So that is the area whereby they need to really concentrate and like take proper food, which is a balanced diet, like small frequent diets. It could be 5 meals a day, but in a small portion, whereby it includes everything, like a portion of fruits, a portion of carbohydrates, a portion of protein, a portion, like properly well balanced diet is very important to build their immunity. Secondly, about the breastfeeding, I would really like to enlighten is that there are mothers who have gone back to work and they are still breastfeeding their child, like because the duration of like us here working here is like three months. We get maternity and then we have to go back to work, but for exclusive breastfeeding period is like 6 months. So what can they best do is they carry their pumps maybe at work. This is what we others do. We carry our breast pumps at work, and then we make sure that they are sanitized and they're like sterilized, and cleaned properly at home. So when we are carrying, it's in a closed container, in an airtight container. We carry it to work, and then we make sure that we are going in a secluded place or in a room whereby we can express. There are Ziplocs readily available whereby they can put the milk in that and then freeze it, or maybe just keep it in a cooler or just an airtight container, because the breast milk can stay outside in just a normal room temperature to 4 to 5 hours at least. And if it's in a cooler, it can stay at least 2 to 3 days. And then if you want to freeze it, then it's 6 months. So if that's the advantage we already have, so we can always play around with the time, So once when you've already expressed, put it in a Ziploc, make sure it's an airtight container, and then you can carry it. And then once when you're home, you can freeze it and do the whatever, like once when you're done expressing, of course, you wash your pump properly. Make sure that whatever you're using, like for example, the sponge you're using to wash it, make sure it's not shared with any other thing. and not any other utensils. It should be kept separately for that particular purpose. And then once when it's done, make sure that the sponge is dried in the sunlight. Don't just keep it inside in the kitchen or somewhere in the room. Make sure that you're keeping it in a container, but there is a sunlight direct towards it. So these are the precaution measures you can take, of course. And then once when you're home, make sure you keep the milk in the freezer or wherever you're storing it. And then once when you are back, the same rules apply. Like you have to go shower, make sure your clothes are put in a Dettol diluted water again, and then they're washed separately, and so like that. And even if the child comes back from school, the same rule applies with them as well. Once when you receive them, make sure you are disinfecting their school bags. Make sure that you have a separate box kept near the entrance door whereby you keep that, and their shoes should be kept separately. Don't bring them inside whereby there's like the bedroom or the living room. Just make sure that they are kept aside in the box. And then once when they enter home, make sure that you encourage them to wash their hands. And then it's best for them to shower and then eat their food and then do the other activities whereby they can carry on to do any other daily activities. So once when they come, the rule applies the same. Disinfect their clothes, make sure they shower, they wash their hands, and then they're eating their food or doing any other things. So basically, there is nothing like we can say there is specific thing we need to do for children. Yes, teach them. The only thing you can do is give them more time and explain them with practical examples that why they're doing like that. Because you cannot just tell them, okay, do this, do that. No, it will confuse them and it will create a lot of panic around them that why do we have to do these things, because they're not used to. So make sure you're teaching them with practical examples, allow them to digest slowly, and then make sure that they do these things in front of you. When you tell them, okay, I've taught you how to wash hands, now can you show me, so that they can continue doing at their school when they are not with you, of course. So these are the things whereby we can make sure that we are educating others, like especially the pregnant women or the lactating mothers, of course. Exercise is very important. Make sure like we teach them, especially the mothers. Usually we forget to rehydrate ourselves. We forget to do exercises, which is very important. So these are the other things whereby you can include in your health education when you're teaching them, when you're telling them that these are the important things to take care. The other thing would be that whenever they are breastfeeding, of course, they have to make sure that they are also eating a lot of important nutrients so that they cannot fall weak when they are working. So these are the things whereby we can educate them with. Over to you, Dr. Zara.
Thank you, Mr. Tabassum. I think that was very important to address because children are equally able to transmit and spread the virus as much as adults. And therefore, we have to be extra careful when they come home from school or other social areas. Moving on to the next segment of our discussion, a huge dilemma amongst the people who are ill is when to seek medical attention. So, Brother Aliaskar, can you enable us to differentiate between a coronavirus infection and other similar respiratory illnesses? And we mentioned about checking or assessing oneself at home. So how can we assess ourselves at home and when to seek medical attention?
Okay, thank you. So the first part of the question is that how can we differentiate between COVID-19 and other similar illnesses? Well, the short answer is that there is no clear way except by doing RT-PCR test. That's a swab test that goes to the lab and COVID is detected. The symptoms of COVID-19 overlap with upper respiratory tract infections very much. You get fever, cough, some difficulty breathing, similarly to when you have an upper respiratory tract infection or a pneumonia. But there are, however, a few specifics of COVID-19. For example, loss of smell and taste. You don't get that very often in an upper respiratory tract infection. Or extreme fatigue or difficulty breathing, which is not very common in an upper respiratory tract infection, but it is more common in COVID-19. So certain blood tests can be done, and that would give the doctor better clue that this could be COVID-19. A chest X-ray, a CT scan can also have some specific changes that are COVID-19 specific, and that is when the virus has already started causing respiratory symptoms. So the second part of the question was like checking, how do you check yourself at home? So first of all, you need to pay attention to your symptoms. Okay, from the first day, you may even opt to chart them down that, the first day, this is the day that I started my symptoms, and the first symptom was this, and the progression as it goes. Because the second week of the disease is when the day 7, day 8 is when usually, if patients are going to deteriorate, they start getting difficulty breathing in that part of the disease. The second week, early on, 6th, 7th, 8th day, you start getting difficulty breathing, the cough gets worse, you feel extremely tired, and things like that. So you also need to keep in contact with a doctor or your primary care physician. Okay, so you involve him, you keep him in the loop, tell him that, look, I've started these symptoms, but I want you to follow me up, or I will give you, be a proactive kind of thing, because you should be the one prompting that this is the symptom I've got, this is the day I started, and I'm feeling worse today, or something like that. So that is one way. That is another way of checking yourself at home. If you are in one of the high risk groups, the high risk groups will be mentioned later, but if you are in one of those, stay extra vigilant, because know that you are in a, for example, if you are elderly or you have diabetes, know that you might progress into a severe form of the disease. So be extra vigilant. You may opt to even keep a pulse oximeter at home. That's a small gadget that measures the oxygen saturation. Just plug it into your finger. There are various videos online where you can see how to use a pulse oximeter correctly. So that will tell you how much your oxygen level is. In a person who without any prior lung conditions, a reading between 95 and 100 is normal. 90 to 94 is kind of the yellow zone, but less than 90 is when you should, it's an alarm, it's a red flag. You need to go to the hospital, and you may call in early on and just go to the hospital. So when to seek medical care, these are the kind of the red flags, which I think we'll talk about it in the coming up segment. But basically, when you're checking yourself at home, make sure that if you have some symptoms, isolate yourself from the rest of the people at home. You can stay in a room where there's good ventilation, away from the other people, and so that you contain the disease. Back to you, Dr. Zahra.
Thank you. So, since you've already mentioned that certain groups are at a higher risk of progressing to a severe form of the disease, Dr. Shamsher, can you enumerate these groups for us? And while you're at it, we have a question from one of our viewers tonight that, is there a specific blood type that is more resistant to the coronavirus?
Okay, very well. Before we go into who are at high risk, maybe we need to understand what the severe form of the illness actually means. So when we talk of the severe form of the illness from COVID-19, it is by definition any type of illness that requires either hospitalization or admission to the ICU or intubation or mechanical ventilation or death. Even just hospitalization is already being deemed as the severe form of the disease. So there are certain groups of individuals who are at a higher risk of getting the severe form compared to others. So Dr. Liasgar has already mentioned a few of those. The elderly, they're at a higher risk of developing the severe form. There are persons with underlying medical conditions, diabetes, hypertension, cancer patients, chronic kidney disease patients, patients with heart conditions like heart failure, coronary artery disease, cardiomyopathies, patients with blood disorders such as sickle cell disease and thalassemias, any patient with lung conditions such as asthma, lung fibrosis, cystic fibrosis, or chronic obstructive pulmonary disease, patients with dementia, cerebrovascular disease, liver disease, and certain studies have shown that even obesity obese patients or obese individuals are at a higher risk. Not forgetting anyone with a reduced immunity. Now, there are many reasons to get a reduced immunity: malnutrition, or diseases causing immune suppression, such as cancers, or medication that causes immune suppression, anti-cancer medications, or those for transplant, or those patients who are on steroids, and other conditions that actually do cause directly suppression of the immune system. This list is not exhaustive because research is still underway. We are still getting to know much more as time passes. So this is not the full stop for this list. There will be additions to the list with time. Of note, we should also mention pregnancy. Pregnant women are also at an increased risk because it is also associated with a weight gain and also lowered immunity. But we should not say that life should stop. Carry on with your hospital visits or your clinic visits as scheduled. Carry on with your medications. Just that if you fall under such groups, you have to be extra vigilant in terms of precautions and preventive measures. You have to take extra care. So regarding the question about blood groups, it's a bit too soon to say if there's any blood group that is more resistant or more susceptible to getting the disease. But studies have shown that there are certain blood groups that have been found to have a higher incidence of the disease compared to others. And in vitro studies have shown that the cell surface protein interaction with the viral spike proteins are more marked in certain blood groups compared to others. So mentioning the blood groups should not be cause for alarm if you are falling in that group. If that is your blood group, you should not be worried. You should not start panicking. Just remember that the precautions and the preventive measures are most important. So yes, blood group A and AB have been found to have a higher interaction with the viral proteins in vitro studies, and O and B have lesser interaction. But we should also take note that these studies were performed in other countries, not in our setting. And some of the studies involved homogeneous population, which means that there was no varying differences in terms of ethnicity. So let's not jump to a conclusion that having a certain blood group is going to put me or you at a higher risk compared to somebody else. But studies are ongoing and we should have some answers soon. Thanks.
Thank you,
Back to you,
Dr.
Dr.
Sherali. I think it's important to reiterate that a relationship does not necessarily refer to causality because, I mean, like you mentioned, just because somebody is A or AB blood group type does not mean that they will definitely progress to a severe form of disease. And it's also important to remember that most of these risk factors are still undergoing lots of research and trials and experiments, and we are yet to have more answers. We have another question from one of our viewers, which I believe, Dr. Aliesker, you briefly touched on. Somebody has asked, I feel I have COVID and my symptoms are controllable, so I don't need to go to the hospital. I'm also isolating myself, but just in case, should I still do the COVID test? And in addition to that, also, Brother Aliesker, can you also elaborate on what one should do after they've taken the COVID test and after one test is positive for COVID-19? And like we talked about managing mild cases at home, so what should one do whilst they are self-isolating at home, and for how long do they need to isolate themselves?
Okay, the question is quite long. It has different segments into it. So the first one was, let me address the question that the lady asked, that she thinks she has COVID, she has the symptoms, and she has self-isolated. So would I recommend a COVID test? If she has all the symptoms and she is self-isolating, I would not recommend a COVID test. There is no need as such, although she can do it. There is no harm in doing it. But what I would recommend is that take it as it is COVID. Touch base with your primary care physician, and if he thinks that these symptoms are completely COVID, and other blood tests are suggestive, are giving you clues that it is COVID, then let us manage as a COVID patient. But if the doctor thinks that this is something else, so he needs to rule out other causes of maybe the symptoms that she's getting. Maybe she has another form of, she has a pneumonia, or maybe she has another disease that is causing similar symptoms. So that I would recommend her to specifically ask her doctor who is taking care of her to advise her on that. And if she has any of the risk factors which we mentioned, she should be extra vigilant. She can use a pulse oximeter. She can also ask, someone at her home to count her respiratory rate, how many breaths per minute she's taking. That is a good marker to know that whether you are really short of breath or not. Sometimes, and the person counting the number of breaths should not tell the patient that I'm doing it now, because that would cause more anxiety. So they can do it when the person is asleep or at rest, and without the patient knowing. I would like to point out here that there are some red flags for patients who are suspected COVID or who are confirmed COVID. So difficulty breathing is one of them, which is a very, very it's clear cut. Once you have difficulty breathing, that's a red flag. Go to the hospital. You might need oxygen. A saturation less than 90. So as I said, up to 94 is acceptable. 90 to 94 is kind of the yellow zone. You need to be very careful. Below 90, go to the hospital. A respiratory rate more than 25 is also one of the red flags. A sudden onset of chest pain, central or left-sided, or just chest pain which is not something that you've ever experienced before, go to the hospital. Severe abdominal pain could also, is a red flag that you need to get addressed. Sudden onset of confusion or altered mental status, or sudden weakness of one side of the body, that is also a red flag. Bluish discoloration of lips or nails, that shows that you are hypoxic, you need oxygen, you need to go and get yourself checked immediately. So the thing you said that some people are asking about what preventive things can I take. Can I use dexamethasone? I hear that it's the wonder drug and it's the thing that is curing people. Or can I take ivermectin? Or others know what tocilizumab is. So there is no drug that has shown to prevent COVID-19. There is no drug that you if you take, it'll prevent you from getting the severe form of the disease. Okay, ivermectin, dexamethasone, none of them should be started without a doctor's prescription. Please, they might do more harm than good. Others, start on oral aspirin. They say that because this virus causes a lot of clots, and they start taking aspirin every day. It's not a good thing, because you might bleed yourself out if you don't have COVID, and if you're not in that state of the disease, because at certain points of the disease, these medications are advocated, but this only the doctor should advise you. There's one supplement which is vitamin D, which has conflicting evidence that it could be helpful, it could not be helpful. What I would suggest is that get your vitamin D levels checked. Because of our lifestyle, we tend to be indoors. Even our women, mostly they wear hijab, and they don't go out a lot, so they don't get that the vitamin D exposure from the sun. So if they can get their vitamin D level checked, and if it's documented and it's low, then only they should start supplements, and that even after a doctor has prescribed. So you asked the question that what next after testing positive for COVID-19. So now I did the swab and I got a positive test. So first of all, do not panic. It's not the end of the world. Okay. You should have a positive outlook to what you are facing. 80% of the people will get a mild form of the disease, and they will fight it off with their own immune system. However, the rest are at risk, and especially those who are elderly and the other risk categories that Dr. Shamsher has mentioned. So first of all, once you're positive, wear a mask more religiously now. Isolate yourself from elderly and those with other comorbidities. Stay in a room alone, if possible, with proper ventilation. If you are in one of the risk categories, be extra vigilant, as I had mentioned before. Watch out for those red flags, which I said. Okay, check using your pulse oximeter, your oxygen saturation. And here I would like to mention that those who are, those who have chronic illnesses like asthma, hypertension, diabetes, they should not stop their medication. Once they've been diagnosed with COVID-19, they should not stop their medication. They should continue their medication, because having a proper, sugar control and blood pressure control is paramount for for a good outcome in this disease. Even if you're asthmatic and the doctor has, and you have your regimen of using your inhaler at certain intervals as prescribed by your doctor, then go ahead and do that. And yeah, for mild cases, so we go on to mild cases, and what can be done? First of all, the mild cases should be treated at home. Okay, can be treated, and they should be treated at home. The symptoms are more or less fever, fatigue, loss of smell and taste. So they need supportive care. They can have paracetamol for controlling their fever, for their muscle aches and back aches. They need to hydrate well. They need to take food that will optimize their immune system. They need to be extra vigilant, which I have mentioned many times now. They need to isolate themselves at home, away from others. They need to keep a doctor on the loop. Means make sure that you are in contact with the doctor. Don't fight this all on your own. Make sure you have a doctor with you on WhatsApp, or disturb the doctors. This is the time to disturb the doctors. And yeah, don't forget du'as, recitation of the Quran, giving sadaqah. All these are beneficial adjuncts for any disease whatsoever. So yeah, that's it from my side for now.
Thank you, Dr. Aliasgar. I think it was extremely important what you mentioned about not taking medications over the counter or without proper consultation from a medical doctor, especially when we're talking about antibiotics and steroids. Sometimes as doctors we hear of people telling us that I've already bought a pack of medicines and I'm ready to take them, or sometimes they take them, and I think it's important to remind our viewers that please do not take any medications over the counter without proper medical advice. Sister Tabassum, you mentioned quite comprehensively about nutrition and exercise. Can you educate our viewers on some of the ways in which one can keep healthy and naturally build our immunity? So we mentioned vitamin D and vitamin C, but also keeping in mind there are a lot of herbal concoctions out there in the market that supposedly are going to lower the risk of COVID-19. So can you shed some light on natural ways of building our immunity?
First and foremost, not all herbal medications are proven, tested, and done researched on. So everything you watch on the YouTube is not everything right and need to be practiced at home. Because I've seen many people wherever they receive these kind of videos whereby they have to take a lot of ginger and a lot of other things mixed in the water and stuff like that. It's good and beneficial. I'm not saying it's not, but I'm just saying that proven and tested herbs should be used and not any other herbs, because that ends up spoiling our kidneys, and we end up having chronic kidney diseases as well. So make sure that whatever content you are getting, it should be either from CDC website or WHO, whereby there are proper guidelines, whereby they are proven, tested, and then researched on. That's when you can use those kind of herbs. Don't just jump into any other herbs, whoever tells you that this is good for your body. So that's one. Another thing I would like to enlighten is eat fresh food, not processed food. That is very important. So whatever you cook has to be fresh. Don't overcook your vegetables, of course, because you're losing all the nutrients in that. And whenever you have a snack time, make sure you're including raw veggies or raw fruits. That's more, they say it has more minerals and more vitamins in that. So basically, if you have a snack time, include more veggies rather than the fried snacks which we are so used to, like bhajias and kachoris. So that it's best to be avoided because of the immunity, of course. So include raw veggies, which is very important, like carrots, cucumbers. Those are good to include in the diet. Another thing is rehydration. We forget to rehydrate ourselves. If you know that you're constantly on a run and you have to reach here and go there, do things, you're always doing your chores. So then just make smoothies so that you can even have it on your way wherever you are going, or have fresh juices. If you don't have time for eating fruits, make sure you're drinking fresh juices rather than the fizzy drinks, because those are contain a lot of sugar and even a lot of salty should be avoided at the same time. So make sure you're balancing with those. Natural sugar is much more better from the fruits like banana and mangoes, of course, but added sugar is not very good. So that again, like Dr. Shamsher Ali said, that like obesity and diabetes patients need to take care on that aspect as well. So if they have to take care about their diet, then it has to be like, if they cannot consume a lot of juices, so they can at least have an orange or half an apple during the midday. So that's rich in vitamin C again. It's best to avoid juices because we usually add sugar in that. And plus, when you have to make juices, you consume a lot of amount of, let's say you want to make orange juice. By squeezing only one orange, you just don't get one full glass. So you end up squeezing like 3-4 oranges to get a proper orange juice. So that for diabetics should be avoided. So it's best to have one piece of orange and a piece of apple rather than having the juices. So for diabetics, they need to take care on that aspects as well. Moderate amount of oil in the food is also important, and not deep fried stuff. Make sure you're consuming foods which have natural oils like nuts, avocado, fish, and then you can use olive oil, you can use canola, you can use coconut oil. Those are all like healthy oils again, which are good and beneficial for the body. Choose white meat instead of red meat, because we know that red meat has a lot of side effects related to the heart and stuff like that. So it's best to choose white meat, which is also rich in protein, rather than the red meat. Eat less sugar, less salts, like I've already mentioned. Salt, now, if I say less, people will be asking me how less, because sometimes too less is a bit more also. So 1 teaspoon is okay in like a day. You can have 1 teaspoon, like 5 grams of salt in a day, which is okay completely. Avoid eating outside. That's another thing I wanted to highlight, because whenever you go eat outside, you have to have a gathering. Going outside, it's a little boring. So if you're going in a gathering, then again, you're not maintaining the social distance. So make sure that you're avoiding to eat outside. Make sure your choice to eat it's at home. Another thing is I wanted to highlight about even the counseling and the psychosocial support, especially with those who have chronic illnesses, because especially the kidney disease patients, they always have a special diet whereby whenever they're restricted from that, and even again, they feel that they have less amount of food or nutrients to consume. So make sure that you're giving them a psychosocial support as well, and tell them that they should meet their dietitian. They should not just, take things on their own hands and then use the other like herbs and everything. So it's best for them to sit with their dietitian, ask them question on how many kilocalories they're supposed to take, what fruits would be benefit for them, what kind of proteins and food in the balanced diet is supposed to be included in their diet, of course. So those are the things I wanted to highlight. Thank you. Dr. Zara, to you.
Thank you, Sister Tabassum. So I think that was elaborate on what we can do to build our immunity. Towards the end of our discussion, Dr. Shamsher Ali, can you please talk us a little bit through the recovery process? So, what to do during recovery and after recovery, and if somebody has been infected with COVID-19, can they be reinfected? What are the chances of being reinfected? And let us also talk a little bit about the vaccinations against COVID-19. Who is eligible for the vaccinations, and are they safe to take?
Yes. Like any other disease, there is a convalescent period where recovery has to take place. And it is both an individual effort, a group effort, and in some part from us health professionals as well, we have a role in it. But the most important thing to remember is the preventive measures. That is the most important, precautions and preventive measures, because being a viral infection, the body will maintain some form of immunity. But this is a novel virus, it's a new one. We currently, studies have shown, recent ones, that the immunity lasts anywhere from 6 to 8 months, but it is not lifelong. So that means that just because a person got the infection, it does not mean he cannot get it ever again. The possibility is very real. It is there. There have been reported cases, although early on after recovery, the chances are a bit low. But unfortunately now we've got variant strains, new mutated versions of the original or the wild type, the one that originated from Wuhan. So some of these have been shown to be more aggressive, more contagious, and cause more severe disease. So the recovery process involves your own effort in terms of recovering physically, maintaining a healthy lifestyle, the diet, the exercise, and the preventive measures. Make sure that you do not expose yourself again to get another infection, because the chances are there. Studies are still ongoing to look at the rates of reinfection, and although the preliminary reports show a very low rate of reinfection, it should not give us a false sense of confidence that we cannot get the disease again, because there have been reported cases, especially now since the new strains are spreading. So please follow all precautions. Now, when it comes to vaccinations, who can take the vaccine? Well, ideally, a vaccine should be available for everyone. Anyone who is at risk of the infection should have the option of getting a vaccine. But let's look at this as a global situation. Each country has got its own rules in place, its own programs in place. So first and foremost, let's adhere to our country of residence where we are. Myself, my fellow speakers and viewers, follow the guidelines set by your resident country laws and protocols. So currently, like in Kenya, we do have a vaccination program which has started. So as I said, anyone and everyone who is at risk should be eligible to get the vaccine. That said, there are some who probably should wait. Now, who are these that should wait? Those who actually are currently experiencing symptoms of COVID-19. Though it does not mean you should not get vaccinated. Once your symptoms have resolved and you have recovered, you should or you can get vaccinated. There are certain groups that will be of interest. Pregnant women or lactating mothers. Should they get the vaccine? So the theory behind or the rationale behind a vaccine is risk versus benefit. And so far, nowhere has it been reported that the risk outweighs the benefit of getting vaccinated. But unfortunately, it's not common to see studies involving pregnant women. But there are individual reports of pregnant women who got the vaccine and then they delivered, and then cord blood was tested for antibodies which were found to have been passed on to the fetus. So that is an individual report. We should not take it as definite, because we need evidence-based results and guidelines. Lactation, again, most of the studies involved with lactating mothers were basically looking into viral transmission rather than antibody transmission. So currently there are no reports, no studies, but the official statement from the WHO is do not discontinue breastfeeding even if you have been vaccinated. And I think breastfeeding was already covered by Sister Tabassum. That being said, what about the safety of the vaccines? Now, for a vaccine to be released, and especially in such a situation where we have a global pandemic, they usually go through a very rigorous evaluation and safety protocol measures for validation. And WHO with national regulatory agencies have done that before they approved certain vaccines for the rollout through certain programs. One may ask, because there are different types of vaccines that are being used. Certain countries are opting to use a certain type, other countries are opting to use the new technology. When we talk of the new technology, it is the mRNA technology, which has also been assessed for safety and has been approved. And it should be noted that those do not interfere with our natural DNA. But yes, they are safe for vaccines. Efficacy, when we talk of efficacy, we are talking about the ability to produce a result. Now, what we need to know is that the efficacy is a measure in a controlled environment. These are controlled studies where all other parameters are controlled, monitored, and not left to any random chances. But the efficacy is usually different from the effectiveness, which is now a real-world scenario. There is no control, there is no randomization. But we do use the efficacy. In certain disease conditions, when we talk of efficacy, the need determines the level of efficacy that is acceptable. So even a 50% efficacy is okay, approved, because the need for the vaccine is so high, because the benefit from the vaccine is going to be significant. For example, malaria, right? So for COVID, the efficacy was set at 50%, but most of the vaccines that are available, the efficacy is ranging. It's not 100%, but it's not 50 either. It's somewhere between 60 and 95, depending on the type of vaccine that you are going to take. As we said before, getting the infection, there is a certain time that you will have natural immunity, but it is not going to last. And again, with the vaccines, we still do not know how long the immunity is going to last. But studies are still going to be done to evaluate how long the vaccine gives us the immunity. That means that at one point in time, after getting a vaccine, the effect is not going to be there, probably, maybe. We cannot say for sure until we have concrete evidence. So again, getting the vaccine does not mean that we throw aside all precautions and preventive measures. Those continue. The other thing about the efficacy and the effectiveness of a vaccine, we should make it clear that it is not going to stop us totally from getting the viral infection. No, that's not going to happen. But what the vaccine does is it prevents the severe form. Now, earlier we mentioned the severe form involves hospitalization, admission to ICU, or mechanical ventilation and intubation, or death. So most of these vaccines, some do not have the data, but most have given the data. Most of these vaccines are almost 100% effective at preventing the severe form of the disease. So we should not fear from taking the vaccine, because I know some persons are very cautious when it comes to taking the vaccines because of side effects. And yes, the vaccines do have some side effects, and they are varying, they are different depending on the vaccine. Some are mild to moderate and short lasting. These include fevers, headache, muscle pains, chills, even diarrhea. The most common complain is pain at the site where the vaccine was injected. But again, depending on the different vaccines available, it is varying. So the next question would be, so which vaccine should I take? The ones that are set in your country's protocols, the ones that your country has approved, and the ones that are available. Do not say that why not this one and that one, because at the national level, a lot of factors have been taken into consideration before making such decisions. So please follow your national guidelines. When we talk about side effects, of note is that there are certain reports in the media about certain vaccines and the side effects, and there'll be some other reports about certain vaccines being stopped. Let's not just take those, because as was mentioned earlier, again, association does not mean causality. Just because something occurred after a vaccination does not mean the vaccine is the reason or the cause. So again, these incidences are being investigated by the WHO and related agencies, and we are waiting for their reports. But when it comes to benefit versus risk, the benefit far outweighs the risk by a great margin. So should not be afraid of the vaccine. Talking from the Kenyan perspective, we did start the vaccination program, and as of 17th March, because these are weekly reports that are being submitted, which are also available in the WHO website, we have received approximately 9,100 doses of the vaccine, individuals. Of course, this is phase 1, where it is the frontline individuals, the health workers who are being vaccinated in phase 1. But let's not forget that statistics are also of importance, because as of the same date, the positivity rate was also exactly 16.8%. This means that almost 2 out of 10 people that I will meet here will be COVID positive. That's many, right? So again, the precautions and the preventive measures need to be in place. So please follow the guidelines that have been set. And not to put a gloom on the talk, but yes, there are still deaths occurring. And the week as of 17th March 2020, the week that ended on 17th March, Kenya has reported 55 cases. New cases are 1,279, and confirmed total cases are over 100,000 in this country. So statistics tell us the magnitude. So let's not think that now that we do not hear of it, it is not there. It is still there. It is still killing. It is still spreading. So please, let's all follow the preventive and precautionary measures. Thank you. Back to you, Doc.
Thank you so much, Dr. Shamsherali, for being so thoroughly elaborate on the aspect of vaccination and for sharing such relevant statistics from your country. Unfortunately, in the essence of time, we will now have to come to an end to the discussion. We hope that we have answered most of the questions and the queries from our viewers. And earlier on, we mentioned about the psychological aspect of the pandemic. So whilst we're looking after our physical health, let us also not forget to look after our psychological well-being. The pandemic is responsible for a huge amount of stress and anxiety amongst the people, whether it is someone who is suffering from the virus, whether it is someone who has lost a loved one to the virus, or whether it is someone who is not able to deal with isolation at home. So let us continue to look after ourselves. Let us adopt positive self-coping mechanisms. Dr. Aliaskar mentioned prayer, but there's so many of them out there. Physical exercise and everything that can keep our mind healthy. As human beings, we are social beings, and therefore, even though if we cannot gather, let us not forget to continue checking up on each other via the phone and reminding ourselves that we are there for each other and we are in this together. And finally, let us talk about the coronavirus in a positive way, because sometimes talking about it in a negative way is responsible for a huge amount of stigma within the community, and this actually prevents people from seeking help when they need it. We hope that you have enjoyed our talk show tonight. Once again, I would like to thank all our viewers and our panelists for sharing their knowledge with all of us. If you have any further questions or queries, please find us through the Africa Federation or the Mahdi Health Initiative Facebook or Instagram, and we will be happy to answer any of your queries and concerns. Before we end, I would like to remind our viewers of the next event by the Africa Federation that will be live this Sunday, that is tomorrow, 21st March, which is the part 2 of the Bloom series, Getting Closer to Allah, Why Am I Not Thirsty, by Sheikh Mikdad Roshnali Alidina. This will be tomorrow, Sunday, 21st March at 8:30 p.m. East African time. Thank you very much. We hope you have enjoyed.